I'm Dr. Ed Pittman, board-certified plastic surgeon, founder of Pittman Plastic Surgery, a world's leading clinic. With breast surgery, there are a lot of options that we're going to discuss. The first thing we're going to discuss is saline versus silicone gel. Saline implants have been around for a long time. We know they're safe because they're filled with saline, which is the same fluid we run into your IV. They're not as popular as silicone gel, at least in my practice. We use about 99% silicone gel. Silicone gel is this implant, and it's been studied by the FDA for more than 15 years to ensure its safety, and it's currently the most studied medical device in the history of mankind. When it comes to selecting an implant, there are a lot of decisions that we have to make. As you can see from this table, we have 6 different implants, and this does not even include saline. They come from the factory deflated, and we add saline at the time of surgery. These are silicone gel implants. They come from the factory already filled and sealed on the back, and they come in different shapes, and they also come in different strengths or cohesiveness of silicone gel. These 4 shiny implants are from Allergan. This is the Natrel implant. These 2 implants, this is a new implant to America called Motiva. It's been used around the world for 15 years, and it was introduced into the US about a year ago. This is also silicone gel, but you'll notice the surface is dull. That's because it has a very fine micro texture to the shell. And what that has shown is that it has a very low incidence of developing scar tissue around the implant. And if we develop scar tissue and it contracts, the implant becomes firm or displaced in the breast. So this is becoming a very popular implant. We use a lot of both. Patients are happy with both. When we talk about silicone gel or saline implants, we have different profiles. This one is called extra projecting. It projects out from the body a fairly extreme amount. Then we have moderate. Moderate implants are taller and wider, but a little bit flatter. And this is a popular implant in patients who have had children or had weight loss or just had natural aging of the breast, in which the breast tends to flatten and drop. And those patients' main complaint is that they want more volume in the upper part of the breast. So we use a wider implant to give us more correction. Full implants typically are patients in their 20s who don't have much breast tissue. They want fullness, they want projection, and they sort of want to look like they've had an implant. So that's a very popular implant for the younger population. And then we have to talk about what type of gel do you want? Do you want a soft gel? This is called a soft touch implant. It tends to teardrop just a little bit when it's in the body. Or do we want cohesive, which some people call a gummy bear implant, where the silicone molecules have been cross-linked more tightly? This implant maintains its shape in the body, which gives you a more implant look and more fullness in the top of the breast. And then Motiva follows suit with both a round implant and a teardrop shaped implant. So lots of decisions to make. It's going to take an hour to go through that. We want to make sure you're comfortable with your decision. We want to make sure you're getting exactly what you want. So we're going to combine this with Vectra 3D imaging. We're going to also let you try on the implants that we've selected with Vectra. Another beautiful thing is that we do all of the surgeries in our own surgery center, which is part of our office. And it's important that you know that it's a real surgery center. It's licensed by the state of Georgia, by Medicare, AAAHC. Difference in a hospital is we don't operate on sick patients. We don't do infections. So it's a beautiful place to have elective aesthetic surgery, and it's extremely private. It has its own separate entrance and exit, and patients love being able to have their surgery in a private, safe setting. Breast surgery is complicated. There are many decisions that have to be made. And I think the most important part of the process is finding a surgeon that will listen to you, that understands your goals, that is able to provide the result that you're looking for. Board certification is so important. It's validation that this person has undergone rigorous training and testing and is at the top of the field. I think it's nice if a facility has their own surgery center. Everything can be done on site, and it's really important that the whole process is focused around the patient to ensure that we're delivering the goal that you're looking for. To learn more about breast surgery, visit worldsleadingclinics.com.